Hi, my name is Michael. I'm from Excelsior University LPN to RN program, and I'm here to do the IV skill competency test. Before we get started, let's go over what's on the table. So right here I have gloves, I have the IV bags, IV bag, normal saline, and the antibiotics, the marked the doctor's orders, the primary tubing, the secondary tubing, hand sanitizer, alcohol pad, and the mannequin with the ID and the IV connector. So let's go over, let's hand sanitize. Let's go over who our patient is and what they're getting. So Ellis Davis, date of birth is 9/19/66. She has no known allergies. She's getting two medications through IV. She's getting sodium chloride. She's in a 500 ml bag, and it's going to be running 125 mLs per hour. So by doing the math, it's 125 divided by 60 times 15, which is going to be 31 GTT per minute. Next, the other bag is going to be the cefalozone, which is the antibiotic. It's going to be running 30 minutes, so it's 50 divided by 30 times 15 equals 25 GTT per minute. The next thing is we're going to hand sanitize again and check the medications. So we have sodium chloride. There's no particles in there, and the expiration date is 7/2031. The next medication is cefalozone, which is the antibiotics. Again, no particles, and expiration is 7/2031. So we are good. Next thing, we're going to hand sanitize again. Introduce ourselves to our patient. We knock on the door. Hi, Ellis Davis. My name is Michael. I'm from Excelsior University Medical Center, and I'm an RN. We're going to be giving you two medications through the IV. One is going to be normal saline, and the other one is an antibiotic called cefalozone. Before we get started, can you confirm your full name and date of birth? So she goes Ellis Davis. Date of birth is 9/19/66. Alright, so the next thing, we're going to hand sanitize. We're going to be spiking the bag. Put this up a little bit. So we're going to make sure that this is locked, which is in the locked position. Make sure that's... And then we're going to spike the bag. So next thing we're going to do is prime the line into the trash receptacle. We're going to make sure that there's half saline, half full. I'm going to prime the line. So we prime the line. Tangled. Alright. So the next thing we're going to do is we're going to hand sanitize and check on our patient's line. So we're going to hand sanitize. We're going to don some gloves. Don some gloves. We're going to ask the patient, do you have any pain at the site? There's no edema, no infiltration, and no redness, so that is good. So next step is we're going to connect the line, but before we do that, we're going to clean the site, the connector vigorously for 15 seconds. So we're going to do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. We're going to take. So we already primed the line. So we're going to just connect. And the rate is to confirm that the rate is 31 GTT per minute. We're going to take our gloves off. Taking our gloves off, we're going to hand sanitize. This is where we're going to start. Drops per minute. We're going to start. It's going to be 31. We're going to start now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31. So we're going to clamp the line so there's no spillage there. I'm going to hand sanitize. Hand sanitize, and then we're going to hang the next bag. So we're going to disconnect this. I'm going to make sure that this is locked position. I'm going to prime the tubing, make sure that this is not spiking the bag. Spike the bag. We're going to hang it above the primary tubing. We're going to make sure that there's halfway. Then we're going to prime the halfway. We're going to prime the tubing. So we prime the tubing. Next thing is what we're going to be doing is going to be hand sanitizing. Putting on some gloves. And again, assessing if there's any pain at the site. Hey Alice, do you have any pain at the site? No redness, no edema, no infiltration. So we're good to go. Take that off. Take the gloves off. We are going to hand sanitize again. And then we're going to do the drop sprinkler. So what we're going to be doing is making sure that this is all set. We're going to connect this. Just checking on the time for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then we're going to connect. We're going to make sure that this one is, the primary line is clamped. Then we're going to count. It's going to be 25 GTT minutes. So it's starting now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Next thing we're going to be doing is going to hand sanitize. Put some gloves on. And again, we're going to check for any pain, infiltration, edema. Alright. Alice, do you have any pain? She states no. There's no infiltrations, no edema, no redness. So that's good. We're going to take our gloves off. We're going to hand sanitize. And then we're going to document. So we gave sodium chloride. It's going to be in a 500 ml bag. It's going to be a rate of 125 mLs. And it's going to be 125 divided by 60 times 15, which is 31 drops per minute. And then the next medication we gave was cefalozone, the antibiotics. It's in a 50 ml bag. It's going to be running for 30 minutes. So 50 divided by 30 times 15 equals 25 drops per minute. Alright, so we are all set. And thank you guys for watching. And hope you have a great day.